And today's lecture is the worldwide trend and the Korea trend of the Davinci robot surgery. So, as you all know, in the worldwide trend, Davinci robotic system is very popular in worldwide. So in the USA, in all around the world, the 8,000 robotic surgery system has been installed based on the date of June 30, 2023, and half is installed in the USA, and 1,500 installed in the Europe, and in Asia, almost say 1,300 robotic devices are installed. For the robotic surgery, numbers of the robotic surgery has been increasing and increasing every year. So in the 2 years of the 2021, it overcome the 1 million cases in the worldwide. In these days, in last year, they calculated 1,800,000 cases performed in last year. It's very huge amount of the increasing of robotic surgery in the worldwide. So I think that the robotic surgery is not a kind of the new way for surgery, but it's a popular way, and we must be learn about the robotic surgery as a well surgeon training. It's the same with the worldwide procedure. In the last year, 852 cases of general surgery has been performed, and the total of the 45% of the robotic surgery proportion in among the all kind of robotic surgery last year. And the specialty for the general surgery comes about half percent, 46% of the robotic surgery next year, and follow the gynecology and urology. And this is the market trending for the robotic surgery for the Davinci in the USA. So they analyzed that the major market for the robotic surgery is the prostate surgery, but the mainstream market is the hernia or general surgery and cholecystectomy. So in USA, there's only cholecystectomy remains the early market for the robotic surgery. So they have some kind of very good promising area for the robotic cholecystectomy and the robotic general surgery. Now we are moved to the Korean statistics. In the Korea, Davinci surgery system is installed around 152 systems as of the June 30, 2023. And almost we have the Davinci Xi for the 96 system, and the Davinci X, some kind of the profitable version for the Davinci Xi, the 22, and also single port system Davinci SP installed 21 devices. For the robot surgery in Korea has also increased year by year, and it started in first year started in the 2005, 2006. It was very small, but in these days, robotic surgery has been up to the 50,000 cases in a year. So maybe in this year, it will be 55,000 cases in this year, they expected. For the procedure, it was started from the urology at the earlier period, but increasing the portion of the general surgery, and also you can see the gynecology surgery will be dramatically increasing these days. So in the latest data, the most popular surgery in Korea is gynecology, and after that, urology is next, and the proportion of general surgery is the third. In Korea, you see the total trend of the Korea procedure, and urology is 34% in this period of this year, and gynecology also follow same as the urology, and the general surgery is the second. But in Korea, robot surgery has some kind of the possibility for the more growth as a market position, because only we have the early market in the hernia surgery and cholecystectomy, because only less than 10% are performing the robotic surgery in Korea. But the major market is prostate surgery, and the mainstream market is still in the gynecologic surgery and the thyroid surgery here. So in Korea, we have the very good possibility for the growing market for the robotic surgery. In Korea, as I mentioned, prostate surgery and the gynecology surgery, the myomectomy or hysterectomy, and the thyroid surgery is very popular in Korea for the robotic surgery. Among the general surgery, we started also in the 2005, and these days we are approached to the 10,000 cases in a year. For the general surgery, among the whole procedure performed in Korea, only 18% are performed in the Davinci surgery. So we have so many possibilities for the growing market for the Davinci system. And also in general surgery only, we have hepatobiliary surgery like a cholecystectomy by the robotic, and the stomach surgery and colorectal surgery is following. And we have the less percent of hernia and breast surgery, but it will be more increasing year by year. Most often performed Korea general surgery procedure is the cholecystectomy is the first, and the colorectal surgery, including low anterior section, is the second, and the stomach surgery like hysterectomy is third. And other surgery like you may be keep in mind that the thyroid surgery is not included in the portion of general surgery. It will be included the head and neck, so I will mention it later. As for the colorectal surgery, only takes up to the 3.7% for the all colorectal surgery, because many Korean colorectal surgeons are pursuing a laparoscopic method, so remain will be the most laparoscopic. But the proportion of the robotic surgery will be increasing year by year, and main proportion for the robotic surgery is rectal surgery, not the colon surgery, because for the rectal surgery we should approach the deep portion of the pelvis, and it is very helpful to approach the pelvic area using the robotic compared to the laparoscopic approach. For the cholecystectomy, only 7.6% are performed in the Korean market, and the robotic surgery has a proportion of the high proportion of possibility for the growing market for the cholecystectomy. And last year, maybe 4,000 cases are performed in Korea for the robotic cholecystectomy. In this day, they moved to the single port robotic cholecystectomy as a Davinci SP system has been introduced. And for the hernia in Korea, there's also popular method for the hernia as a laparoscopic method, but in these days, robotic hernia surgeon has been increased, and last year maybe we did around 200 cases, and in this year we may be expected for more than 400 cases for the hernia surgery in Korea. Hepatobiliary surgery, cholecystectomy takes a big part of the hepatobiliary surgery in robotic surgery, and following pancreas surgery and liver surgery. So in Korea, there's also in the, you may know the several hospital, they have the robotic Whipple surgery or robotic PPPD surgery. They can also do the make a leading trend for the pancreas surgery. Also for the liver, left lateral sectionectomy or the right hemi-sectionectomy is recently attempt to the robotic surgery. So the most performed general surgery in this year is the cholecystectomy, and the following the colorectal surgery. And in this case, the robotic mastectomy has been introduced and using the Davinci SP system. So the total mastectomy for the patient with the DCIS patient is recently doing in many centers in these days. Now, finally, I move to the head and neck surgery. So Korea is a leading group of the head and neck surgery for the robotic surgery, especially for the thyroid gland surgery. So in the last year in Korea, we have the 6,000 cases for the robotic head and neck surgery. But the proportion of the robotic head and neck surgery still remains around 10%. Only 11% has been performed the robotic surgery. Remains are the open and endoscopic surgery. And the last year, most popular surgery in the thyroid surgery, around 78% for the BABA and the transaxillary. And the transoral robotic thyroid surgery up to the composed in the 14%, and other surgery include the tongue-based or the head and neck cancer is remained. So major surgery is thyroid surgery, and the parasite surgery is still low, but thyroid surgery and thyroid surgery with the transoral surgery comes up around 80 to 90% for the head and neck surgery in Korea. And the number of the head and neck surgeons also increasing year by year. So it will be more growing market for the thyroid surgery provided by the robotic in Korea. And the last year for the Davinci head and neck surgery, 91% was performed in the thyroid surgery among the head and neck surgery. So thyroid surgery includes transaxillary, BABA, transoral, and retroauricular, or comes to 91%. And after introduced the Davinci SP system, so we used only the 20% for the head thyroid surgery as a SP system, and other 80% is a multiple system like a Davinci XI. So for the thyroid surgery, we have many type of the approach for the thyroid approach, including the transaxillary and the BABA, the retroauricular and transoral surgery. So as you see, around the 40% transaxillary is trained by the Severance Hospital, and remainder 40% is BABA, trained from the Seoul National University affiliation, and retroauricular are performed by the ENT surgeon, and transoral surgery is performed in the Korean University Hospital. So as we see, the BABA and the transaxillary is main portion of the thyroid surgery, and following the transoral surgery. Finally, in my last section, I will introduce SP system. So number of Davinci SP system is installed worldwide is 137 systems in the worldwide, and the USA they have 112 devices, and in Korea we have the 21 devices in the nation. So for the USA, they perform the urologic main and following head and neck surgery, and 4% and less than 2% is GS and gynecological surgery. However, in Korea, this situation is different. So in Korea, main uses for the Davinci SP procedure is the gynecology and following general surgery and the head and neck. In Korea, Davinci SP system installed 21 devices, and among the total surgery, SP system used to compose up to the 12% among the all robotic surgery in Korea. And SP proportion in the Davinci SP, it was introduced later of the 2019, and the proportion of the SP procedure are getting increasing year by year, and cumulative cases in this year or a period, it is the main percent is gynecology and following the general surgery and the thyroid cancer. Most often performed procedure of Davinci SP is mainly is a thyroid for the surgery only. Thyroid surgery is the most popular surgery in the SP system, and the following the cholecystectomy is next, and the other gynecological surgery, hysterectomy, myomectomy, cystectomy are widely performed in the robotic SP system. This is the final slide, and my hospital also started robotic surgery in the late of the 2018, and we overcome the 2,000 cases in the last month. So we celebrate this kind of symposium, and we make a big plan to make a global training center will be installed to my hospital. So maybe you can see me, and also you can see Mr. Lee in the later part of here. And it was my last visit of the Taj Mahal around 2017. But yes, maybe in this visit I visited Varanasi in the Tuesday or Wednesday. It was very good experience for me. And thank you for inviting me.